Hi, everyone. It's Dr. Martin. Thanks for joining me for another Einstein News. This is the week of December 3rd. So thankfully, RSV in our region has continued to decline, and we expect to see that pattern continue for the next 6 to 7 weeks. Unfortunately, other areas are still experiencing spikes, but we seem to be past the worst of it, and hospitalizations seem to be down and continuing down. So that's great news. Unfortunately, we have an uninvited guest, and that's flu. And so flu cases across our state are at the high or very high levels, which is the highest you can be. And I would say at our practice, we're seeing the majority of those kids we test for flu are positive. So flu usually presents with high fever, anywhere from 3 to 6 days. They can have chills, body aches, headaches, sore throat. Thankfully, I can report that kids actually are doing very well with it, despite not feeling, great for a few days. They are recovering pretty well, and so I'm happy to report that. And the other piece of this, why RSV cases have been way up from prior years in terms of raw numbers. Flu, despite it being early, and that's the kind of spike you see early compared to other years. It is not higher than it's been in other years in terms of number of cases. ERs in urgent care is about 6 to 8% of cases that are presenting there are from flu-like illnesses. That hasn't changed too much over the last few weeks, so it's sort of constant but not spiking up, which is good. So that brings me to Tamiflu. So we definitely every year have discussions with families about Tamiflu and its role as an antiviral in the use of flu. It's important to know that it is only useful in influenza, and so we're going to use it in cases that we have tested. The other thing that you should know about this is that it's, the CDC reports that after 48 hours, there really in kids seems to be no benefit to using Tamiflu. And so we do have to, if we are going to use it, we need to use it within the first 48 hours. Unlike antibiotics that you would give for strep throat or ear infections, Tamiflu does not kill the virus like those antibiotics kill bacteria. It only slows their ability to replicate. And that's why it's so important in the first 2 days probably. And it's not dramatic. It's, you see 1 to 1.5 less days of illness, a slight decrease in symptoms, but you're still going to feel sick. Kids are still going to feel sick, and it's ultimately the body that fights off the infection. And so Tamiflu helps some, but it's certainly not a miracle cure. So there is something if we have discussions, if we do test a patient within the first 48 hours. So that brings me to the third in our trifecta of illnesses this year, which is COVID. And so thankfully, COVID cases still remain low in our region. But again, we do anticipate some spike after the holidays in January, February, probably as flu decreases. And so that gets into the conversation of vaccines. And so we have good news to report. For those kids, as of November 22nd, the CDC is reporting kids 6 months to 5 years, there will be a bivalent or an updated vaccine for those age groups, both a Pfizer and Moderna product. It is not going to replace what they've gotten, but if kids are still in the process of getting the 3 doses that are required for kids under 5, that third dose of Pfizer can be substituted, and rather than get the old version, they get the new version. So what does this mean? If you have a child 6 months to 5 years, and they've gotten the first 2 doses, when they are due for the 3rd dose, they can get the new vaccine. They should still, any child just beginning the series still needs to get the old version for the first 2 doses. It's only the 3rd dose that they would get the new version. If they've already completed the 3 doses, at this point, the CDC doesn't recommend a booster dose of the newer Omicron bivalent version of COVID-19 vaccine. If you got a Moderna product at the health department, again, we won't be carrying the Moderna product, but there will be a Moderna bivalent vaccine as well. And you can substitute on the 2nd dose, you can get the Moderna bivalent updated Omicron vaccine as the 2nd dose. Again, if you've completed the Moderna series, which is 2 doses, you would not at this point be recommended to get the bivalent or updated booster. Hope that all makes sense. If you have questions, please leave them in the comments section. I'm happy to answer those. I will also report, and this is very important, we do not have this vaccine yet. We're anticipating in the next few weeks we will get it. We will keep you updated. So it is an issue. If you have a child that may be due for their 3rd dose of the Pfizer vaccine in that 6 months to 5 years, you may want to put off a couple of weeks, especially since cases are still low, so that you can get the updated version. So we'll keep you up to date. As soon as we have it, we will let you know that. I'm hoping before the 1st of the year is sort of what we anticipate. So at Einstein, like many other medical facilities you're reading about across the country and in our region, we are continuing to struggle with about 3 times volumes of what we normally experience during respiratory virus peak season in the winter. And it's really probably, I think, best termed as an immunity debt we're paying back right now. And what I mean by that is we've got 3 years of kids who did not get RSV and other respiratory viruses, and where all of these kids would have gotten these diseases as they're normal to get during childhood, no one escapes them. It got condensed into 1 year instead of 3. And so that's put a real stress on our systems, both at Einstein and other medical facilities. And so we are struggling, and I can't say it more strongly than that, to get patients in for same-day appointments that want them. We are doing the best we can. I will tell you, we just simply cannot meet the demand that's there. And so I meet with Leanne weekly, and we really do work the schedule over to try to maximize those slots. So I would ask if there's less urgent things that you be more flexible with the staff and schedule them out in advance and not take those same day slots. We're really trying to reserve those for kids who are acutely ill with some of these respiratory viruses like flu. On that note, I would like to say on behalf of my staff, we really are grateful for all of you and your patience with us as we work through this. We are trying as hard as possible to meet everyone's needs. And so we really do appreciate you being patient with us. And on that note, I hope you all stay safe and remember to be kind to one another. Thank you.